our immune system puts on flags on any sort of aberrant growth in the body, and then a part of immune system which is like the cytotoxic T cells, they will come and kill off those cells and remove them. And what cancer does, one of the innate properties of cancer, out of about, there are 10 unique features of cancer, one of the very specific properties of cancer is what we call as immune evasion. And different cancers use different immune mechanisms to avoid it. And one of the things that has been seen in, certainly you may have heard on the news, in melanoma and lung cancer, it seems that the cancer cells, they block one of the protein called PD-1 and B7, and that causes, it sort of like fools the scanning system of the immune system. So, the immunotherapy, we are only beginning to see the first generation or the beginning of immunotherapy. What those drugs do is they restore the immune system scanning system, and then the immune system deals with it. Now, that is only one of the many ways a cancer cell can fool the immune system, and that seems to work most in melanoma followed by lung cancer, and there are benefits seen in bladder cancer and other cancer types, but for most breast cancer this does not seem to be the main driver of immune evasion. So, even though there is a lot of noise about immunotherapy and a lot of success about immunotherapy, in breast cancer per se and 97% of bowel cancer, this does not seem to work, or these class of immunotherapy drugs do not seem to work. There is a lot of work currently going around to test these drugs, the current PD-1 inhibitors or checkpoint inhibitors like we call them, in breast cancer, as well as there is a lot of work being done at the moment to find out which immune mechanism does the breast cancer use, so that drugs can be engineered against them in coming years.